I would say when it comes to the direction that the market, especially the employer sponsored market, is going, where it's moving away from these traditional fully insured products and moving into these alternative health plan products, whether it's level funding or captives or other types of financing and funding and risk bearing for the health plan piece. And all of the big incumbents are launching their own products or buying products in the space as well. I think level funding is probably the biggest alternative funding type that is growing extremely quickly. I think that'll continue. I think the other major trend that is still relatively small in terms of scale, but and as a result may have very high growth rates, but is very it's kind of the hot thing right now is our ICRA products, and I think that is a product that is extremely beneficial for certain types of employers.
Welcome to the Scale Healthcare Technology and Innovation Podcast, where we explore how innovative technology is revolutionizing U.S. healthcare. Hosted by Jason Schiffman, president of Scale, we sit down with industry leaders to uncover the strategies, breakthroughs, and technologies shaping the future of care. Join us and subscribe as we dive into the cutting edge of healthcare innovation.
Joined today by CEO of Angle Health, Wang. Ty, thanks so much for being here. Looking forward to the conversation.
Thanks for having me here, Jason. I'm excited.
So we've been doing a lot of work on the employer market and innovation within that market. We've covered it from different perspectives. My understanding of Angle Health is that the company is an AI-enabled health insurance plan. Is that a correct summary?
Yeah, I think that's a good starting point, but I think what Angle Health really is we are an AI native, vertically integrated healthcare company where although our core products and what we're known for and deliver to the market really well today is full service health plans for employers, we provide a lot more than just the health plan piece, and we're truly full stack in that we are an insurer, we are a third party administrator, and we're also a healthcare services company where we have a variety of services that exist within and beyond the health plan itself. So things like care navigation and prescription optimization programs.
So there's a lot to unpack in terms of what you're offering and why you're offering it. But maybe let's take a step back and just talk from a market perspective. So on the provider side, we're seeing a lot of organizations as they achieve size and sophistication are thinking about interesting ways to engage with employers, with payers, with the traditional carriers, and actually outside of the traditional carriers, either directly with employers or through intermediary partners. And so we're seeing a lot of innovation in that market. And I'm just wondering, from your perspective, what portion of the market on the employer side are you focused on? And within that market, what are the key trends that you're seeing from your perspective?
Yeah, so our focus and it's really always been since we started the company has been focusing on small and medium-sized businesses and really democratizing access to modern healthcare services for these SMBs that historically haven't always had access to all of the newest or most modern types of provider or clinical services or even administrative or financial aid services that you generally see at a much larger employer at companies that are thousands or tens of thousands of employees. And our focus is really bringing that experience and that level of access down market. And you mentioned kind of how providers are really approaching more creative ways or innovative ways of engaging with employers and payers and potentially doing that directly as well. I think a really important fact there is that when you're talking about those kinds of programs, they're primarily working with these jumbo employer groups, these very large corporations and companies with thousands, tens of thousands, hundreds of thousands of employees. And these are extremely valuable relationships that with Angle Health, we are in some ways kind of unlocking and bringing that down market to SMBs and to the companies that I would argue have the employees and the populations that really need access to to these kinds of services. And a lot of that, I think one kind of core tenet that we started this company on is that we noticed that over the last 10-15 years, there's been an explosion of new ways of receiving medical services. So when you think about things like telehealth and telemedicine and chronic disease management programs and behavioral health programs, a lot of them are, especially the more digital health ones, are directly contracted and primarily distributed through employers. It's not the retail chains or the restaurant groups or these mom and pop shops and SMBs that are the ones that are able to pay these large companies like Omada Health or Livongo or Hinge Health 6-7 figures a year for their employees to access it.
And how do you
And
define SMBs that you're focused on? What size employee count?
yeah, so we at Angle Health, we really focus on employees that are 500 employees or less. But where I think we really see a lot of traction and where our products are really appealing to are in the sub 100 employee space.
And who is your primary audience? Is your primary audience that employer or their employees, combo of both? And maybe a second part to that question, a big part of the strategy for large cap employers is cost savings and also keeping their employees healthy so that they're productive and showing up to work. Is the primary focus of what you're offering these employers cost savings, or is it improved service, or
Yeah, we really see it as both. And we, as a health plan and as a full stack health plan, we interact with every piece here where although we are distributing to employers and working very closely with brokers and agencies, our end user or end customer is ultimately still the member or the patient is the end consumer of healthcare who is covered by Angle Health or covered by their employer who is working with Angle Health and is the one accessing care. And we really see it as one and the same in that when you look at these kind of large cap companies, these large employers that are offering these kinds of services and programs to their employees, they're not doing it purely because, well, I guess sometimes it's done purely because offering additional benefits or additional services is viewed as a richer benefit package for recruiting and talent. A lot of the times they're really interested because they're fully self-funded and they're interested in actually lowering the overall cost for the benefits and for the healthcare of their employee population. So we really see it as by being able to bring these kinds of integrated products and services and benefits down market, we're doing that in an attempt to really reduce the overall cost of healthcare and improve the health outcomes for these SMBs who historically haven't been able to access these more sophisticated programs.
So let's go through an example. Let's say I'm an employer with 100 FTEs in my business, and from the employer side, I am focused on employee recruitment and retention. I'm probably pretty frustrated to have 10+% annual increases in my healthcare cost, and I'm probably paying 75 to 80% of the premium on behalf of my employees. On the employee side, I'm probably thinking about the costs that I'm paying out of pocket. I'm used to accessing the Cigna network. How does life change from that scenario on the employer side and on the employee side with Angle Health?
Yeah, so our goal with our members is really and the employees of the company when they join Angle Health is to really feel like they're stepping into a new kind of healthcare system. But where that really matters is for the high acuity employees, and ultimately those are the ones that are driving a large part of the costs for these employers. Now, when you talk about the SMB space, that may or may not be the case because if they're on a traditional fully insured product, or even level funded or alternatively funded product, particularly with the larger carriers and the incumbents, they may be underwriting or pricing on a block level. So even if you as the employer have a relatively low cost employee population, you may still see significant rate increases because the carrier that you're on today is seeing larger losses from other groups and is underwriting the whole book of business as a block. So that's kind of an aside. With what you described there, the big difference for the members that really need greater engagement and access is being able to engage with Angle Health and our advocacy team and having a resource there for anything as the first point of contact for anything healthcare related, and really as a guide to so that you as a member or patient don't have to understand the complexities of health insurance or how to navigate the healthcare system in order to get access to the right care. For the employer, what that really translates to is not only a better employee experience for your employees, especially the ones that have complex cases, but also stable renewal rates. So the main benefit is, especially over the long term, is no longer seeing those like 10, 20, 30% rate increases year over year, because by switching and by bringing on Angle Health, we are helping you. One, we are pricing accurately to the true costs of healthcare, and also helping to manage those down year over year.
And how much of that is reduced overhead, administrative charges? The large players in the market just have much higher overhead and are maybe charging higher profits versus managing down the cost of care through some of the care management programs and care navigation programs you mentioned.
Yeah, so it's both. So for us as a health plan, today we have tens of thousands of members across thousands of employers, and the size of our business today, we have 100 headcount total. That is, when you look at pretty much any other health plan, TPA in the market that is at our scale, they generally have hundreds of employees, primarily operational, and that's in large part driven by the efficiencies that we've been able to realize through our technology platform, through our infrastructure, and through the AI and machine learning workflows that we've built to support everything from quoting and underwriting to implementation to claims to member engagement and support. So we do see significant operating leverage there, but really, I would say at the end of the day, for the employer, and especially in this SMB space, they're really not used to seeing or to managing, nor do they necessarily want to manage the actual underlying costs of care like a fully self-funded employer does. What they care about is, okay, what is the total amount? What do I have to budget for this year and for the next year and for the following years when it comes to being able to offer these benefits so that I can retain and recruit talent. And that's what we really focus on for our employers and our brokers who are distributing Angle Health, is that we can provide stability there. We can provide the transparency around the data and around the reasons for why pricing is the way it is. And on top of that, we're now helping you to manage that down year over year.
You mentioned 1,000 plus employers. You mentioned tens of thousands of members. How many geographies are you serving?
So today, Angle quotes in 44 states, and we have active groups in a majority of those.
And doing all that with 100 employees, how is that feasible? I mean, I'm thinking about the Aetnas, the Cignas, the UHCs of the world that collectively are a couple $100 billion in market cap. Are there parts of the process that you're relying on partnering with those carriers and health plans on for claims processing for their provider networks? Or how do I think about how you're doing it with 100 employees?
Yeah. So we do rely on outside on third parties for a variety of services. So the provider network is a good example of that. We don't, for the most part, we don't own our own provider networks, and that's actually a huge value prop for our customers and for our brokers and employers, is that we enable them to design their health plans, especially for these small and medium-sized businesses who historically are just used to whatever off-the-shelf product that they can get or that a carrier may offer to them in that market. We allow them to design and customize the product so that it really meets the needs of their employees. And that also includes choosing from a variety of networks that we have relationships with and that we can quote. And that's as well as choosing things like their PBMs or pharmacy networks that they would see the pricing on that. So there are a few kind of these core pieces that Angle Health does not do itself, but partners on. But the vast majority of the actual operations we're doing in-house, from the actual administration of the plans, paying claims, provider and member support, all the core kind of operational pieces outside of network management of a health plan is something that we do. And we've really been able to unlock this because of the integrated platform that we've built. So when we started this company and when we launched Angle Health, we essentially rebuilt what you would consider the health plan stack, or like the infrastructure to support operating a health plan from the ground up on highly integrated infrastructure. Our data sits in one place, and rather than having hundreds or thousands of different systems and data silos, our teams and our tools and applications and platforms for administering our health plans are operating off of this kind of common understanding of the world. And that's also what allows us to embed tools like AI and machine learning at the core of everything that we do, from quoting and underwriting to claims and medical management to member engagement and interventions. And that's how we're really able to unlock the operating leverage that we've seen, which I do think that is something that we will continue to see the benefits of and see the advantages of as we continue to scale. Today, I would say that we're still, although we're definitely the size of a regional health plan, of a serious player, we're still very tiny in the overall health plan landscape. But with the infrastructure and the technology that we've built here, we really see ourselves being able to continue scaling in a way that no one else has has been able to do in this industry, and to be able to continue operating very efficiently while doing while executing on the basics and the very important pieces of a health plan to a T, so that we are able to deliver the kind of experience that we strive to our members and to our employers and brokers and providers that are interacting with us.
You mentioned partnering with the health plans for their provider network. I'm wondering if there are other types of partnerships that you've entered into that have been additive to the value prop as you've built Angle Health over time, whether it's on the technology side or some of these other innovators in the employer market, like the Carums of the world or the Centivos of the world. So how have strategic partnerships played a role in developing Angle Health?
Yeah, so I would say when you think about the core health plan, the other pieces, there's a network, and then there is the PBM and the pharmacy benefits administration partners. So we partner with the very tech forward PBMs and PBAs of the world to be able to offer a similar experience on the prescription and the pharmacy side as they get on the major medical side with Angle Health. Outside of that, we partner with a variety of services around like telehealth and telemedicine. For example, we work with Included Health to offer 24 telehealth to our members, and then a variety of other programs on the chronic disease management side, also on the financial services side when it comes to administering HSAs and FSAs and COBRA administration and some of the administrative pieces there, where I would say the one thing that we are not today is we're not a healthcare provider, and we're not experts in like diabetes management or in cancer treatments or oncology or infusions or anything like that. But what we are really good at doing, and where we really excel, is building the workflows and the rails to be able to identify and engage the members and the patients that that can really benefit from a given service or whether it's a clinical program or a financial program, and make that experience for them very frictionless. Identify and engage and really ensure that patients are able to see through these pieces that help to improve their health outcomes or to improve financial outcomes for both the individual consumer, the member and patient, as well as the employer and the employer's health plan, and the underlying insurers or risk takers on the back end.
Would you say that the health plans, the big players, are just too big to do a good job of addressing this SMB portion of the market? So by working through or with an intermediary like Angle Health, you're able to offer better customization and better service for this portion of the market. Is this just a neglected sort of underserved part of the market, or what is it that prevents the larger players from doing something similar to what you're offering?
Yeah, I think the big piece is inability to, or a lack of interest in being able to deliver, or in delivering these kinds of services in a cohesive, integrated manner to this market. And a big reason for that is it's very difficult to offer these kinds of customized products, custom health plan products, as well as start integrating a bunch of these services in a cohesive manner to these SMBs, because for many of the existing players in the market, all of these things are highly manual processes, whether it's the administration or the engagement, even like building out a health plan, a new plan design for an employer. There's a reason something as basic as that is really only offered to very large, to like employers with hundreds or thousands of employees, fully self-funded employers, because it's a very manual process for most health plans and TPAs to take a plan design and configure all the claims processing rules and the eligibility rules and billing and invoicing and all the downstream pieces associated with that. That's why in any given market, for the SMB space, whether you're looking at fully insured, small group, large group, level funded, you generally see, or other types of alternative funding, you generally see kind of like a few, maybe like 10, 15, no more than like 30 canned plan designs that are available to them. At Angle Health, we have more than 3 times the number of unique plan designs as we do the number of employers that we serve. And that's just something that's really unheard of in the market. And that's a result of our ability to, is the technology infrastructure that we've built, the AI models that allow us to build and do the level of customization and administration configuration that is required for that level of complexity.
You talked about all those different plan designs. What are some examples of different plan designs? Are we talking about different payment models, or are you more talking about access to telehealth and access to mental health services and things like that?
I would say both. So all of our products are ACA compliant major medical health plans. So we obviously have rails around kind of what a broker employer can design when it comes to these custom health plans. But outside of those kind of core sets of regulatory rails, we allow for a very high degree of customization, including things like sliding scales on cost shares, copays, co-insurances, out-of-pockets, deductibles, and the ability to build plans, the ability to select the provider networks of the various options that we are available to them in their given region, to select the PBM or pharmacy benefits partner, to be able to select these additional services, whether it's telehealth or telemedicine or like HSA, FSA administrators, or these other pieces that for a much larger employer is something that the employer may put out an RFP and companies would be bidding on every single one of these pieces. We're able to deliver this in a very integrated manner for these small and medium-sized businesses.
How do you think about managing risk? I mean, as an employer, that would be the other side to the equation. Maybe you get some rightfully or wrongfully security by going to a larger player. How does Angle Health think about managing underwriting risk?
Yeah, so that's an area where we've been very disciplined in, and where I would say we have a fairly strong advantage is that we're exceptional at understanding the risk of the employers and the members that we onboard. And a big piece of that is also pricing and underwriting to that, so that employers are they know what to expect, and we can be confident about being able to provide stable renewal rates. Where I think one of the things that we hear time and time again from our brokers and employers is that they're sick of seeing these 10, 20, 30% rate increases year over year. And something needs to change to so that they're not having this huge level of uncertainty and variance when it comes to their budgets, and especially for small and medium-sized businesses. This is where these are companies that are very sensitive to their health plan is generally their top 1 or 2 line item on their P&L, especially when it comes to payroll and benefits. So what we're really able to bring there by underwriting accurately to the group itself is that sense of confidence and stability um, uh, in those renewal rates. Again, being able to help manage those down uh, uh, through engagement with the Angle Health team, and our various programs and services around that you get just by being an Angle Health member, as well as uh, unlocking the access to these services that historically uh, aren't a part of many of these kind of fully insured products that exist in the market today for the smaller businesses, or the aren't really a priority, or aren't able to be integrated well because of uh, the um, financial incentives and operational complexities, even for larger, like 50 to 100, even 200 employee companies.
I want to shift gears to think about sort of the outlook over the next, call it 5 years, at a company level and then at a market level. So first, at a company level, where do you see Angle Health 3 to 5 years from now? What are what's the growth trajectory? What are the additional services or goals? Are you looking to stay in this particular part of the SMB market or expand? How do you think about that?
Yeah, so I think one thing that's very important about Angle Health today is that we're not just a single product, but really what we've built is an integrated platform with multiple products where we're able to deliver these products in a seamless experience and provide this differentiating value to our customers, whether it's the broker or the employer or the member. And where we really see ourselves going is continuing to move in that direction, where we are really be able to rebuild what we consider care pathways, and really double down on the healthcare services side, where we not only want to be best in class in understanding and pricing, but also in managing risk that we bring onto the Angle platform, and helping others manage risk, whether it's other TPAs or health plans. And that means doubling down on the healthcare services side, and rebuilding what we call care pathways. So for any given kind of course of care or category of case, so an example could be a diabetes case, or a cancer patient that has to go through a course of infusions, being able to take the pieces that today are highly fragmented, where the healthcare ecosystem today is a web of services that is not really bundled or delivered in a coordinated manner. It's one that has many different stakeholders, each with their own incentives. You have the health plan, you have the facility, you have the provider, you have the pharmacy and the drug manufacturers that are providing those drugs. And you have a whole web of these services and pieces that have their own incentives that are maybe optimized for that one piece or that one stakeholder, but not really thought about or optimized for the whole kind of course of care journey. Our goal is investing in really working from first principles, much like we did with the health plan piece, and the administrative services around the health plan. I'm now moving into that healthcare services side and the provider services side, rebuilding what any one of these care journeys looks like in a way that is truly optimal for the consumer, for the member or the patient that is going through this, optimal from an access and quality standpoint, as well as from a financial standpoint.
As you move to focusing on the services side and building out these care pathways to really influence the cost of care, do you see Angle Health being able to continue its market presence across 40 plus geographies, or do you see becoming more focused? I mean, one of the interesting points is that when you focus on the SMB market, I would think some of these employers will not be able to access the benefits of all this coordinated care because their employee base is too small. And so is there sort of a conflict in trying to deliver these innovative, value-oriented services to employers that have capped employee counts?
No, so I actually think that our view there is that's not and shouldn't be a limitation, because at the end of the day, whether you're a really large employer or a really small employer, still the individual member or patient that's going through this piece and that has to access each of these pieces. With a large employer, it's easier from an administrative standpoint or more cost effective for certain pieces of the puzzle. So maybe it's a certain clinical provider or the TPA who is administering that, and that's why it's only accessible or that's why they're only really willing to work with the large employer on that kind of program. We're taking the view that we can actually stitch together and create the same level of efficiency and access down market to the employer. I mean, we're really talking about the individual member and patient level, and ensuring that that any Angle Health member can access the best optimal services for them for a given care journey or course of care.
Yeah, I mean, at your core, you talked about improved transparency. You talked about more flexibility on benefits design. You talked about better service, and now you're incorporating healthcare services into your program. So that's solving a lot of pain points that, frankly, aren't unique to sub 100 employee businesses. So you would think that there's probably a lot of value you can offer to larger employers as well over time. Is that something that you think about taking the company to do?
Yeah. I mean, I think nothing is out of question for us. I think we've built a lot of the infrastructure and a lot of the execution muscle to be able to have proved out and be able to tackle these sorts of challenges. First with our own member and employer population. But yeah, I think there's a huge opportunity, and ultimately we can make the most impact by making these kinds of services accessible to as many people and as many health plans as possible. It's something that we get a lot of inbound interest in already, and it's definitely an area of expansion that we're excited about. I think for us and how we think about this, we really look for the right partners and the best in class partners when it comes to executing on these pieces. And I think one of the challenges is, and part of why we decided to go full stack in the first place is there are just very misaligned incentives across very different parts of the healthcare ecosystem. And as a result, we decided to go full stack from the beginning because we wanted to make sure that we were fully aligning across these incentives and making sure that they were optimal for the member, the patient, and that we had full control of that. Now, I think it's really a matter of finding the right partners here where we can make sure the incentives are aligned so that we can provide the best experience and the best outcomes for the consumer.
Yeah, I mean, it's interesting. You have unique perspective data from 1,000 plus employers. I'm wondering what are the one or two things that have yielded the most improvement, whether it's cost savings or healthcare improvement across these 1,000 plus employers? It's the one or two changes.
Yeah.
If you could go in blind and say that these are most likely to yield results, what would they be?
Yeah, I would say the biggest thing, or I would say one of the lowest hanging fruits that is surprising that it's not more, I would say, widely utilized or more widely available is there are a bunch of things that are low hanging fruit. So things like being able to shop pharmacies and being able to leverage tools like manufacturer assistance programs or patient assistance programs or a variety of these kind of more financing tools that reduce the overall cost of. I would say the big piece is on the prescription side, and there's also the navigation piece on the provider side, where I think it's been a huge topic over the last couple of years with price transparency and everything, where cost is really not correlated with quality and in a given region or any given market. A certain service like an MRI may cost 3 times as much in one hospital or one facility compared to another without any sort of measurable improvement in quality of treatment. So I think there are a few pieces here that are very much low hanging fruit that are not even things that you need a health plan to access, but because they're so because it's so complex, because like even accessing certain programs on for financing drugs is a very high friction process. One, you have to know that a program exists, and two, you have to go through the steps of actually accessing it, whether it's a bunch of paperwork or or like contacting making contact with, I don't know, whatever, like an obscure phone number or something that you
Yeah.
need to like find, or website. These are things that we've removed the friction of, made it very easy for members to either self-serve or for us to facilitate members through and into, that make a huge difference. Even if it doesn't actually make a huge difference for us as a health plan, it makes a huge difference for the consumer, for the patient that's going through this. I think uh, uh, I think that, from at least, especially from like a member and patient experience perspective, I think that's been one of um, uh, the biggest movers when it comes to how we're really changing the way that people interact with and feel like they should interact with the healthcare system.
Is there any minimum infrastructure required on the employer side to be able to work with an Angle Health? Should they have an in-house CHRO or any? So it's pretty limited.
Nope. So we work with employers as small as 2 employees, and our largest employers have hundreds of employees. Um, we do rely heavily on, and we work very closely with our broker and agency partners.
Typically working directly with the employer or through PEO aggregators?
So we're typically, so all of our employers are direct Angle Health customers, and they interact with Angle Health. Uh, we distribute almost exclusively through brokers and agencies. What we found is that for these smaller employers, they don't have a CHRO or a benefits manager or
Mhm.
um, someone dedicated to understanding this, and that's really where the benefit of a broker comes in. Is the broker is able to um, uh, help them design their benefits, help them understand exactly what would be optimal for their employee population, and guide them through those kinds of decisions.
I want to end by going back to the outlook question, but at a macro market perspective, and ask your thoughts about the incumbents, the Aetnas, UHCs, Cignas, Bucas versus the disruptors. And when you think about all the variables, so there's a lot of frustration with the annual premium increases. There's a lot of inertia that benefits the incumbents given their market share and given their familiarity. And then there's a lot of benefits that the disruptors offer in terms of all the things that we've talked about: service, transparency, flexibility, so on and so forth. If you were to look out over the next, again, 5 years, what are your thoughts about market share of the disruptors, the Angle Health, and your peers versus the?
Yeah, I mean, I think we're already seeing a huge shift today when it comes to market share. Well, I would say when it comes to the direction that the market, especially the employer sponsored market, is going, where it's moving away from these traditional fully insured products and moving into these alternative health plan products, whether it's level funding or captives or other types of financing and funding and risk bearing for the health plan piece. And all of the big incumbents are launching their own products or buying products in the space as well. I think level funding is probably the biggest alternative funding type that is growing extremely quickly. I think that'll continue. I think the other major trend that is still relatively small in terms of scale, but and as a result may have very high growth rates, but is very it's kind of the hot thing right now, is our ICRA products. And I think that is a product that is extremely beneficial for certain types of employers. And I think that the market will really move towards, if I were to say like 5 years from now or 10 years from now, I think the market is going to look a lot like it's going to be bifurcated. The fully insured piece is going to be much smaller, and it's going to be very much bifurcated into these alternative funding models and this like ICRA or individual type product subsidized by the federal government.
For those less familiar, us novices, ICRA is
It's the program was launched in 2020. It's an HRA type product that allows employers to pay a fixed pre-tax amount for their employees to purchase health plans on the individual marketplace, on the ACA marketplace.
okay. So you see more creativity on funding, whether it's level
Mhm,
funding or things like ICRA. That makes a
mhm.
lot of sense. Ty, I want to thank you for your time. Appreciate your insights and really enjoyed learning a bit more about Angle Health. So thank you so much.
Awesome. It was really fun being on here, Jason. I appreciate you having me. And yeah, for any of your listeners, feel free to reach out if they have any questions. I'm at Ty, Ty at anglehealth.com.
Thanks again, Ty.